Hey guys, this is Health Nibble number 54, if I remember. Excuse me. It's on heartburn, and some of the treatments can be really harmful. So, sorry, I have a little sinus stuff from the lake this weekend. But anyway, so a lot of people are on proton pump inhibitors. They actually block the acid, and the real problem with heartburn is oftentimes not enough acid, or there's a bacteria in there called Helicobacter. But anyway, these proton pump inhibitors are oftentimes cause more harm than good. And it's like most things in life. You can't take a drug and get away with it long term without problems. I when I was a kid, I can't remember. It might have been a Tums commercial, but this big guy bellies up to the bar at a cafe, and he needs to take his heartburn medicine so that he can shovel down a chili cheese dog and a soda or something. So obviously, I mean, most people know what the problem is there. It's not a deficiency in heartburn meds, that's for sure. So anyway, some of the problems that these proton pump inhibitors can cause are kidney disease, heart attacks, magnesium and B12 deficiencies. And when they were first invented, they were supposed to be temporary, like a 6-week program, for an acute phase, which really, in my opinion, is how most medicine should be used. There's a time and a place for them, but short term, and then get to the root cause. I think most people would agree that if you're trying to resolve a situation, you have to get to the root cause, and medicine doesn't really do that. But it changes the pH in the body and the GI tract, and so it causes bacterial overgrowth. So you can get a nasty bacteria called C. diff growing. It can increase your rate of bone fracture. Trying to think of some other things that it causes. Anyway, some of the arguments that patients have, they go, well, I have Barrett's esophagus, which the cells are changing down in the esophagus because they're exposed to stomach acid, and then that leads to cancer. But when you actually look at the research, that squamous cell cancer has dropped a little bit, but the adenocarcinoma has risen. The number is from 4 per million in 1975 to like 25 per million. So drastically increased, even with all of these people using proton pump inhibitors. So long term, they cause lots of problems. So what are some of the solutions? Well, a lot of times there's a hiatal hernia problem, so it's a physical problem, and that can be caused from could be trauma, could be that you're overweight, could be so all of those things. It always comes down to lean your body out, eat well. I mean, those are some solutions there, but in chiropractic, we can actually pull that stomach or correct that hiatal hernia. Not always permanent, but sometimes people have an acute hiatal hernia, and we can pull it down out of the diaphragm, and then it starts working again. The other thing that I mentioned earlier is oftentimes the problem is not enough acid. So taking 2 to 3 teaspoons of apple cider vinegar, mixing it with 6 to 8 ounces of water, and taking that when you eat can really help improve your digestion so you don't get that reflux. The other thing is Helicobacter pylori is a bacteria, and that's definitely an issue, and we have ways to resolve that on our functional medicine side, along with all of the obvious things, which is clean up the diet. Processed foods really wreak havoc on the digestive system, causing these reflux problems. And then you can also, everybody's a little different, so some people react to certain foods, so just remove those from your diet. So that's your health nibble for the day.